Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Tonight's program is called Pelvic Stabilization. It's a dangerous program. It's dangerous for healthcare practitioners because if you have lower back pain, radiating pain into the legs, or symptoms into the lower extremities, to do this self-help program today will make all of the difference in the world in doing an ectomy or elimination of healthcare practitioners and the self-empowerment of your lower back to rid one of the #1 musculoskeletal problems influencing our society. Backed by popular demand is Dr. Kenneth Kearstan, chiropractic physician and sports injury specialist. Dr. Ken, welcome back.
I'm glad to be back.
Also with us today is Leslie Ebbets. Leslie, thank you for joining us today. Leslie is a patient at the office, and she was chosen and decided to come with us today. She's a very positive person and underwent a personal transformation over the course of the past 2 years through using a combination of exercise, diet, Pilates, and just overall spiritual well-being. She was an excellent subject to work with us today, and Leslie, who is a Bedminster resident, is here to be demonstrated upon. Leslie, thank you for joining us today.
Thank you.
Please stay tuned. We'll be right back.
Okay, again with us today is Leslie, and she's been a patient of ours for a couple of years. We haven't seen her recently because she's been doing so much better now. And the idea we want to interject today is a process and something that a patient can do at home and take that knowledge with them so they can maintain a level of good health and well-being. And we're going to specifically talk today about low back pain and what we need to do with low back pain. Low back pain is the #1 condition that we treat at our office, either chiropractically, physical therapy. It's a major complaint. And due to the fact that it's a lot of times it becomes debilitating to a patient, and they can't function throughout their day. So what we need to do is not only make the correction and get them out of the pain, but make that transformation to make them overall a better picture of health. And what we need to do is, what most people have the problem is a deconditioned spine. What a deconditioned spine is due to either injury, long-standing posture imbalances, that the deep muscles of the abdominal and low back become very weak because they're not used. Most of the time we're only using our dynamic muscles. Even if we're going to the gym and working out, we're only working on the rectus abdominis, which is the muscle that runs from the xiphoid process all the way down to the pubic bone, that is the trunk flexor. And they're also incorporating the external obliques, with the muscles that run from the corners here. Most people work on those all day, and they're trying to and they feel good, and they're looking good, but they still have a weak core. They still have weak abdominal, and they're still coming back with low back pain. So we need to reassess and find out exactly where their pain is coming from and why it's there. So many years, actually, chiropractors and physical therapists have been working on pelvic stabilization or core strengthening. And it's now catching on. It's very popular. It's catching on with the athletes in rehab. It's catching on at the gyms. And you're starting to see a lot of those physio balls or pelvic stabilization balls, the big round balls. And they're doing those, and they're getting programs in with those, and they're great. But the problem with that is that they're putting people on programs, on stability balls and unstable surfaces before they can even do the basic pelvic stabilization. And that's what we're going to accomplish today. We're going to go through some basic exercises you could do at home. It doesn't take long, and it's something that you don't need anything but a floor. And that's all we need. This is very, very low tech, but it's very, very important. And by doing these exercises, you're going to find that it's self-empowering, and you're going to see a major, major difference in your back pain by reconditioning. So we need to strengthen our core, and that's what we're going to do today. So let's get right to the chase here, Leslie, and we're going to talk as we go through these. But what we're first going to do is you're going to lie on your back with your head up here. The first and most important thing we're going to incorporate is the two major muscles, or the stabilization muscles, which are our transverse abdominis and our internal obliques. The transverse abdominis is actually an abdominal muscle that wraps around very deeply and it attaches into the spinal muscles of the low back. The internal obliques are the muscles of the exact opposite of the external obliques, and they run posterior and obliquely back this way, and they also attach to the low back muscles. So by incorporating abdominal muscles along with the low back muscles is a very key. People think they just have to work on their extensor muscles or the big muscles in the back. That's not the case. We need to work on the whole core, what we call our core, or this is our foundation. And if our foundation is weak, everything around us will then become even more weak. Leg muscles, upper extremity, upper back. And by having a dysfunctional pattern within the abdominal and the low back area, it's going to translate pain into upper back and even lower extremity. So we need to focus on this area and strengthen this. And once we have strength here, you're good to go after that. So let me premise first by what we're going to do is, this is a three-part pattern here. First, when a patient comes in with low back pain, we have to give them a physical exam, assess them, make sure it's a musculoskeletal condition, and continue to treat them. Once we do that and establish what their core focus is, whether it's injury or overuse, we get them out of pain first by using modalities and manipulation and stretching. Then two is to maintain that correction by making sure they maintain a flexibility program at home. So stretching, and I'll give the patients to stretch at home. And then the third part is actually the strengthening. And that's where we need to go into the strengthening. You can't go to strengthening before you get the pain relief and the correction first. You have to go A, B, C. And that's where a lot of people miss out on that. So now we're in the third phase. We're going to jump right to the third phase, and that's strengthening. The first exercise, which is the most important and the key to every exercise I'm going to talk about today, is called abdominal hollowing. There's many different terms for it. It's called abdominal hollowing, navel to spine, many things. But the idea is what we need to do is to activate those deep abdominal muscles. We need to concentrate on how to isolate and contract and pull in our tummy muscles. Okay? Now, when most people pull in, or they say suck in your stomach, what they'll do is they'll take a deep breath in and hold their breath. That doesn't do anything. All that's doing is expanding the chest muscles using accessory muscle breathing. We need to isolate these muscles purely. So what we need to do with that is we need to bend your knees. And what we're going to do is we're going to focus on bringing these abdominal muscles, or really centering your stomach muscles, and bringing the belly button, using the belly button or your navel as a focus here, and bringing that into the spine, close to the spine, and then up through the diaphragm. So what I tell patients to do is use a deck of cards, a wallet, something at home to put on their lower abdominal area. And when I count to 3, you're going to pull in and use those muscles and pull in 1, 2, 3. Pull in. Good. So now what she's doing now is not only is she feeling tightness in the stomach, she's feeling tightness in the low back area across the top of the hips. And you can talk to me and breathe without having any problem, right? You're not holding your breath. No. And that's the key. You should be able to automatically say their ABCs or talk as you're holding this contraction. Relax. Good. Now, once she masters this, this should be second nature. This could be done while you're in the car, while you're driving, while you're walking to work, anything. This is an exercise that is key. And if you can't do this, you can't move on to your next exercises because it's all centered around this. And this is going to protect your back. This is going to stabilize the whole area when you're doing an activity. And I tell my patients so they can get appreciation for this is if they straighten out their legs. A lot of people go home and do leg raises or things of that nature. So you're going to raise your leg without stabilizing, which you're not used to doing. But I want you to just raise your leg for me. Good. And go back down. That puts a lot of strain on the low back and the stomach. She feels it. But now what she's going to do is you're going to stabilize and now lift your good. Now this is a safe movement for her. Now she can continue to do these exercises. You can lower without putting any strain or injury to the back, because people will say, oh, I'm doing these exercises and they're starting to be, it's becoming painful. It's because you're not stabilizing. You have to stabilize first, protect the back, and then make the movement. So what I have the patients do, bend your knees, to master this, we need to do, I usually start them on a 3-set, 10-rep, 10-second hold pattern. So what she's going to do is going to do this contraction, belly button to spine, in, hold for 10 seconds, and then relax for 10 seconds. And she's going to do that 10 times for 3 sets. This is a good start. This is something that's a good marker to do. And she's going to do this at least twice a day. So that's what I always start the patients doing. And I want them to get used to this. They do this for 2 weeks. That's the only thing they do. That's it. Just working on this. And then once they get used to this, they're going to do this in the car, when they're moving, when they go to turn and pick up something. It's like automatically strapping a weight belt on your back, but without using, with using your own muscles. So it makes it safe. So now, we're going to move into a full crunch. Many people do crunches, and crunches are great, but you have to make sure that you're doing it properly. Many people come in, they say they're working their show muscles, like I talked about before, the rectus abdominis and the external obliques. They have a flat stomach, they look great, but they could have the weakest core I've ever seen, and it's happened. It's just very, very weak. So what we need to do is people have to do it 100 crunches a night. I have them do it this way, and they could barely do 20, 25. Okay? So that's why when we do these, we're only going to do these to fatigue. I usually don't put a marker on this for sets and repetitions. I have them do as many as they can, and they stop, and they're going to do 3 sets to fatigue. So what you're going to do is we're going to first do, it's a 3-step crunch. So the first step is actually abdominal hollowing. So you're going to abdominal hollow. Good. The second step is a posterior pelvic tilt, which is you're going to raise, not lifting the pelvis off the ground, but you're rolling the pelvis up, flattening the low back like you're trying to squish something with small of your back. Perfect. Good. So relax. So now what I have the patient do to work up to a crunch is I'll have them do this and then the posterior pelvic tilt and have them work on that for 2 weeks or a week or so till they get used to this. Then when they feel comfortable and they're doing great and they're actually getting bored and it's getting easy, I have them work into a full crunch. So the full crunch is very simple. It's the last part. You're going to cross your arms over your chest. Good. Step 1, abdominal hollow. Step 2, posterior pelvic tilt. Step 3, just enough to get the shoulder blades off the ground. That's all she needs to do. And relax. Good. Many people bring their knees up for a crunch. That's fine too, but they're not really working the whole abdominal area. They're cheating almost, okay? So it's fine, but you're going to get more repetitions that way, and that's fine. So this is the active way to do it. It's like making yourself into a U, I try to say. Perfect. So they're going to do 3 sets of crunches to fatigue, okay? So that means just when they kind of poop out. You're going to do as many as you can. Relax. You can use a marker if you want for 15, 20 repetitions. That's fine, whatever you're comfortable with. That's the first exercise we get them going with. The next one, we're going to get into more dynamic motions, which we're going to incorporate more low back muscles also. So the next step we're going to do is, Leslie, you're going to sit up for me, and we're going to go into our quadruped formation, which means she's going to go into her all fours here. The best position for all fours is she's going to move her hands a little bit underneath her shoulders a little bit more. Good. So you're pretty much looking at a flat back, knees in, 90-degree position. Okay? Now, most people can't get appreciation in what their balance is or how they look back here. So what instead of looking in a mirror and turning your head, what you're going to do is you're going to put a book on your back, okay? And that tells us if we're balanced. So if she's going to lift her leg when we're doing this and the book starts to fall off, we know we're not balanced. The idea for here is to keep the stomach nice and flat, the back even, no tilt here, okay? So we're going to do a 4-step progression. I want to be able to see if Leslie can actually balance on progressively less extremities here. So the first thing we're going to do is just make sure that you can just lift your left arm off the table and balance. Good. Now she did without moving anything. Everything's fine. Put that back down. Now let's check your right arm. You're going to move that up. Good. Not too much movement. Everything's fine. She can go fine with that. Now we're going to lift the lower extremity. So we're going to lift this up. Good. Little tilt here, but not bad. Bring it back down. Good. And then the right one. Good, and relax. Now let me also premise too, by Leslie being on this cushioned table, this is a much more difficult position than being on a hard floor. Just for demonstration purposes today, she's on the table. So what I'll have the patient do after they get used to this, we increase the difficulty level by putting them on an unstable surface, like we're talking about before. So this is actually a little bit more difficult for her. So now we're able to do one extremity, and patient can do that, and sometimes they have difficulty doing one arm or one leg. And I have them do that until they can get that mastered. The next step will be alternating. This is the big difficulty part here now. We're going to alternate left hand and right leg. Good. And back down. And then you're going to do the other side. And usually one side is more difficult than the other. This arm, the other arm. Put this one down and that arm. That arm, the other leg. That's why it's hard, right? See, and even someone that's been doing this for a long time has some difficulty with it. Good, and relax. Now, with this, this is a very, very dynamic exercise. This is very, very difficult to do. It seems very easy, but it's very, very difficult. But let me premise that by doing this, she has to have that abdominal hollowing. She has to maintain that tightness in the stomach, or she can't do this exercise. She'll be very weak, and she'll be what we call a floppy pelvis. She'll be moving around. So she's going to have the flat back. She's going to have the tummy tucked. And she's going to be doing this. So what I'm going to have them do is you're really going to try to extend this time, and it's going to be more difficult for you. But you're really going to try to reach out with your left hand and really reach out with your right leg. Nope, other way, right leg. Right leg. That's okay. Right leg and left hand. There you go. And really reach out and hold. 1, 2, 3, 4, 5, and back down. Good. And that's what the exercise is going to look like. And she's going to alternate and go back and forth. Right leg, left arm, right arm, left leg. And she's going to continue to do that. Good. Now, you're off the hook now, Liz.
Okay, good.
Now we're going to go on your back. Well, thank you. This is very difficult work. Okay. Now, what we're going to do is, this is even more difficult exercise. This is something that is we call this a dying bug, and this takes a lot of abdominal muscles, and you'll see why we call this the dying bug in a second. We're going to incorporate more dynamic motions of the upper extremities and the lower extremities in conjunction with the low back muscle tightening. So again, everything we're going to do here, stabilize here first, and she's going to hold the stomach muscle in. What this motion is going to be is, let's just bring this leg up into a relaxed position first. The rule of thumb here is when this arm's up, this knee's up. When this arm is down, this leg is down. And what we're going to do is she's going to go into almost, not yet, but you're going to go into a crunch position. After she goes into the crunch position and maintains that crunch position, she's going to go into a slow alternating repetition of leg and arm. You think you can handle this, Leslie?
I think so.
Okay, all right. So what she's going to do is going to bring yourself into a crunch position like we talked about before. Good. Bring this leg up, arm up now, like this. This leg's off the table. This arm up. Good. And now you're going to slowly alternate. Perfect. Thus the dying bug. Okay? Good. And you'll find this is the last progression. It's a very, very difficult exercise, not easy to do. And only people that are really in their last stages of strengthening are going to do this exercise because it puts a lot of strain on the back. Good. Excellent. Okay, you can stop. The last one we're going to do is a lateral lift. They call it the mermaid. There's many different things. But you're going to turn on your side. Okay. Now, what this one is again, we're always going to stabilize first, but we're starting to work on more of the oblique muscles on this one. And this is a very difficult exercise also, in the fact it takes a lot of strength. But this is, again, the last stage exercise what we're going to do, and this is the fourth one we're going to talk about. So what she's going to do is a very simple movement. What she's actually going to do is just going to lift her pelvis off the ground, just like that, and back down. And she's going to feel a lot of tension throughout the whole spine, throughout the low back, the back muscles, the leg muscles. And you lift up, good, and back down. Relax. And these are very difficult, and it should only be done at the end. And I don't let the patients go to these exercises until they're ready. And I always don't even tell them about these exercises until they're ready to do it. So you can sit up, Leslie. Good. So those are the 4 basic progressions. This is something that's easy to do at home. You don't need any equipment, and it's as simple as that. But the core focus is that you need to learn how to stabilize and hold that stomach muscle in, which you've done. So now when you go out throughout your day, how often are you holding your stomach in?
Almost about 80% of the time.
Mm-hmm. And
I call it neutral spine.
Correct.
And I find myself in it about 80% of the time.
That's a good way to approach it, and you should do that, because by doing this, you're actually exercising the whole time. You're actually working on your posture, because what happens is a common posture is people that work at their desk or they sit a lot, they develop this type of posture where the pelvic becomes tilted forward and their shoulders slouch, and we call it upper and lower cross syndrome. By keeping a neutral spine, it allows you to straighten up, keep the stomach thin, and you feel better. It's almost like having a string pulled through your head, and they talk about the Pilates. Now, Pilates is something very important. The Pilates is something that I recommend all my patients to go through after they, see me and you're ready to go and start an exercise program. This is a basic book on Pilates. This is the way it's spelled, just in case you're interested. and pronounced. It's called Pilates. Pilates has been around for many, many years, and it's actually a very good exercise program. And what we're looking to do is continue this at home. So if you could find yourself a good Pilates instructor after you're done through this program, it's extremely beneficial. It's something excellent you could do, and it's something actually you only need to do not too often if you're doing it correctly. How often are you doing your Pilates?
I only do it 2 hours a week.
So, and Leslie, in the meantime, has lost, how many pounds have you lost?
40.
40 pounds. Her back pain is significantly decreased.
Significantly reduced.
When you started at our office, you were on a scale of 0 to 10, 0 being no pain, 10 being your pain?
I would say I was probably at an 8, with 10 being the worst. It was debilitating. I couldn't really exercise.
And now that you're doing this whole program, you're at what now?
I would say it's between a 2 and a 3 now. So it's very, very tolerable.
Good. So pretty much, you know, that's the goal. The goal is to maintain a level of function and mobility where, you know, we live in a time where you're going to have, you know, back pain, whether we sit, our everyday activity, things of that nature. And we want to make it to a point where you have, you know, a level of maybe some pain where you can get through it. You only sore for a couple hours, or you're able to stretch out of it. And this is something that you could actively do and take on. So after you get you out of your pain, you get your correction, and you start in the strengthening program, you're well on your way to better health and actual correction of low back pain. And most of the time when people can't figure out where their low back pain is or why they're continuing to have low back pain, it's because they're deconditioned. And by doing this, we're going to recondition our spine, strengthen the deep abdominal muscles, and still get to look good at the same time. You're doing purposeful exercise. You're not doing just random exercise without, you know, really not accomplishing anything. So with this, I hope that you could take something home with this and actually have this exercise program, which you can do. It's basically 4 simple exercises of a progression. And with this, you can actually, you know, take a hold of yourself and actually strengthen and correct yourself. But, you know, if you do have back pain, you make sure you go get checked by a physician and you get evaluated and you find out what the cause is. And then once that's established, you're ready to go.
And work with someone who knows Pilates.
Absolutely, absolutely. Thank you. So that's all we have for today. And if we're, you know, with this exercise program, you should be able to be self-empowered and feel good and take an active role.
Now, how about that? That's really, really good. Now, let's see whether I understand this correctly. We have, number 1, an active pain phase when a person usually presents into the office. So management of their pain and symptoms is number 1.
Correct.
Secondarily is correction and also stretching as the secondary phase of the process.
Correct.
Of a 3-step process.
Right, that would be a decrease of their frequency and things of that nature, more home activity.
Okay, and third would be then this core strengthening. Now, does the core strengthening take the place of doing, let's say, generic exercises or some of these sheets that other doctors may give you?
No,
or
that's all excellent exercises and advice, but the thing is that if you're not establishing your core, you can still be doing exercises and strengthening these dynamic muscles, but still not really working on where the core focus of your problem is. By doing this, you're taking care of the whole low back. It's not a question of, well, I have a weak hip flexor or things of that nature, where leg raises and things of that will help that. But by strengthening the core, it will also help those adjunctive muscles there. So this can be used in conjunction with everything you do, even isotonic exercise, bench pressing, shoulder presses, by holding your stomach muscles in, and you'll get stronger quicker with the other things. So I have my power lifters do the same thing. I have them work on these core stabilizing muscles when they're doing their actually heavy isotonic weightlifting.
is this cutting-edge chiro technology that we're witnessing
No,
right here?
it's actually,
what I really mean to do on it is this a recent rethink of a centuries-old condition?
Yeah, absolutely. I mean, this has been around for a long time. It's just it's coming to fruition now. It's, you know, like I said, you're seeing it more. There's a whole, even in regards to the rehabilitation process, in regards to, you know, lower extremities, ACL reconstructions, shoulder rehab. The whole thing of when they used to rehab, it would be immobilization for such a long time, and then you go into this exercise. Now you're getting movement and activity, I mean, as soon as possible, getting people into a pool. It's all about mobility. It's not about immobilization anymore, unless something is actually unstable. But, you know, you're actually getting into movement and core strengthening, I mean, weeks before they used to.
A quick jump.
A quick jump. It's a quick jump. And it's
the understanding of phases has also become a crucial
absolutely.
issue.
So you could do this, you know, right at day one, you know, for injury, even after spinal surgery. You could do this without, you know, I mean, it's an exercise a day after your spinal surgery. So.
Now, it seems to me when I was watching the exercises to be done that separate from lower back, the strengthening of the total barrel of the body, did they ever do any studies that would seem that the normalization of bowel structure or a healthiness of movement of bowels or helping with constipation or anything like that?
Yeah, because this, I don't know about the studies, but it does help with people with those conditions too. Even if women are familiar with Kegel exercises, Kegel exercises are used deep abdominal strengthening in order to help with bladder control. So this is very, very similar to those types of things. And with this, it will help with bladder control and more just awareness of your abdominal, your whole abdominal area, even visceral.
Leslie, how did it feel in doing some of those exercises? I know that you've been doing a lot of Pilates, and you have your Pilates machine that you're actually working with to give you more dynamics. Did doing some of these exercises now, which may have been different, did you feel some weaknesses or some areas that, even though you'd been doing the one thing, that this kind of touched on? Ooh, I think that's a little something. I think I'm maybe working something that it wasn't. Not to take away from what you're doing, but did you feel a burn?
Oh yeah. I mean, I do reformer Pilates. Mat Pilates is slightly different, but it's the same principles. And you know, if you do something over and over and over again, it's going to be easier. And this is something new, so it was a little hard.
Yeah. It's even like different sports. I mean, if you're used to playing tennis and you play a little racquetball, you know, you start to feel different muscle groups in from what you were before. Now, let me just say one thing. I'll bet that you wished you taped this television show today. And you know what? You probably didn't. But the good news is this, is that we have tapes of this show available to you free of charge. It's just a matter of coming and picking them up at the office. And we are confident that if you use the nature of this particular protocol, you will empower your lower back, your flexibility, your core strength and ability, and hopefully eliminate a lot of misery, you know, in the morning, lower back pain, this whole need for intervention. And you'll really, one thing will lead to another. Who knows? Maybe you'll go out for a walk. Maybe you'll use dental floss. Maybe it's a situation where you're going to start to eat healthy and make lose some weight and realize that most of the things that we get nowadays are lifestyle-oriented issues. Dr. Kearstan, thank you for your expertise today.
Thank you.
You are the man with the big brain. And Leslie, thank you for coming and sharing your time with us today.
Thanks,
and that was good. I think this is going to help countless thousands.